Well, what a pleasure. Absolutely delighted now to be joined by Steve Schmidbauer from Child Family Health International. Steve, welcome.
Thank you.
Nice to see you.
Yes, nice to see you.
So Steve, tell us a little bit about the work of your organization.
Child Family Health International is a small NGO. We work to improve primary health care at the grassroots level, and we do that by finding local health professionals who are committed to their own underserved communities, and we work with them to just assist them in their work. One way that we do that is by creating global health immersion programs, by identifying local experts and then bringing international students to learn from them.
Now, one of the topics we've been talking about a lot this week is equity. Are there issues of equity here?
Well, I think the discussions about equity here are really, really important. Equity is a fundamental principle of global health, and I think we can broaden that discussion a little bit. It's certainly there's the nuts and bolts, like access to healthcare is a very fundamental thing. But I think at a venue like this, we can be talking about equity in terms of our approaches. So as an organization, as a university, as an individual, working internationally, maybe we can be self-reflective. What are our approaches like in terms of equity? Are we really engaging people at the local level? So I mentioned we're using a strengths-based approach, and so if we at CFHI, we're going to a underserved community, if you will, in a developing country, if you will, but we're going to that community first and foremost to see what we can learn from them. So of course we're going to help them and assist them in whatever way we can, but what wisdom is there in that community? What kind of local experts are there? What are the successes in that community? And if you begin with that sort of mutual engagement and understanding and sharing of knowledge, it creates a sharing. So we've moved from international health to global health, and global health I think implies sharing, and sharing is a way of creating equity.
Now, Steve, could we take this one step further and actually move towards a code of ethics?
There is a code of ethics for international NGOs that is out there and that people can freely subscribe to. And I think one of the places that has posted that is the Global Health Education Consortium. GHEC has that on their website. So there's definitely been some discussion about that already.
Steve, thanks very much indeed for joining us today here on Global Health TV.